Tens of millions of Chinese people are on lockdown now due to the Wuhan coronavirus. More than 4,500 cases are confirmed in that country, but the disease is spreading elsewhere, including here in the United States. John Lorink reports.
China says it's sparing no effort to curb the Wuhan coronavirus. That includes putting partial or full lockdowns into effect.
The idea of shutting down several cities is an unprecedented attempt to have a curtailment of an outbreak.
There are more than 4,500 confirmed cases in China with dozens of deaths, and the virus is spreading elsewhere.
We have sustained transmission from person to person. That has to be interrupted, or this can get out of control even more than it is.
There are at least 5 confirmed cases in the U.S., but the Centers for Disease Control and Prevention expects that number will rise. This week, the Virginia Department of Health investigated 3 potential cases, 2 of which were negative. Results for the third are expected later this week.
We're very fortunate because we have a unique pathogens unit, the only one in the Commonwealth of Virginia.
Health officials say they can't detect the virus simply from the symptoms, which is why a patient's recent travel history is an important factor.
So people who have arrived from Wuhan, China, that specific information combined with their symptoms is how we identify who needs to be evaluated further.
I'm John Lawrence reporting.
The CDC is monitoring passengers for coronavirus symptoms at several U.S. airports, including JFK International and Atlanta's Hartsfield-Jackson International Airport. There is, of course, plenty of information floating around about the coronavirus and how someone might contact that illness. KCAU-9 reporter Lydia Vasquez is here now with what local health officials are saying about who should and should not be concerned about getting that virus. Lydia?
Tim, coronaviruses aren't new, but this latest strain you've been hearing about is. And right now, there's no vaccine for it. I spoke with Tyler Brock with Siouxland District Health Department. He says the risk of catching the new coronavirus for most Siouxlanders is very low, but that risk is completely dependent on your exposure. Brock says it's important to make sure you're taking the time and the same precautions you would to prevent any other illness.
The symptoms of this virus are very similar to a lot of other, viruses that we're encountering here all the time. So it's the symptoms plus the travel that we have to be focusing on, and that will be a more accurate determination of what your actual risk is.
Brock encourages everyone to check sources like the Siouxland District Health Department or the CDC for any concerns they may have about the coronavirus. Again, it's important to always take precautions like washing your hands and limiting contact with those who are sick. Lydia Vasquez, KCAU 9 News.